to the BlackMenCryToo podcast. You're here with Kenald. I am Kenald on Instagram, and we're here for another nutritional episode with my lovely guest.
Hi, I'm Angela. My Instagram is @thecurlycognitive. I'm a therapist, a daughter, sister, friend, lover, human being.
Keep going, right? I love it.
Let's see, I love Beyonce. I love traveling. I love finding the balance in life. I like to work hard and play hard.
Yeah, that's good. That's great. I think we have all the essence of ebony and blackness, right? We got the curly hair cognitive.
The curly cognitive.
The curly cognitive, and we got the beehive in the whole mix.
We do.
At once. Like, you can't get no better than that.
You're right.
Right? Awesome, right? And you're a sister, you said?
Yep.
What else?
Daughter, lover, friend.
Lover. Wow.
Yes.
There we go, right?
Yep.
Black love, right?
Yes.
We got to vote for that.
Yes.
So awesome. So we're going to have this conversation today and just unpacking things that matter to us in our communities. And as I think you have to share what you do. What's your professional role?
I'm a therapist.
Okay.
I work with individuals 18 and up that are going through anxiety, depression, relationship issues, lifestyle changes, and couples. I also work with couples as well.
Awesome, right? So people, you have two therapists sitting before you. We're only about 6% of the therapists that's out there, right? So it's only 6% of us that are black, and even less of us are black males. So we have these statistics against you, and it's important for us to pay attention to this conversation because we're going to be going into the deep waters and the out of bounds areas as well, right? So tell me a little bit about your therapeutic career. How has it been for you?
So far, it's been a blessing and an affirmation. I would say around 2017, that was when I was like deep into my mental health journey, and I was working in the fashion industry, but not really feeling called to do it, not feeling fulfilled. And I was looking for something more, and then also just trying to like connect the dots about things that were happening in my life. And I was going to a therapist. I made the intention to seek out a black woman, and that completely changed the trajectory of my life. It all kind of aligned. Like when I started working with her, I was seeing this successful black woman married with kids who really enjoyed her work. And I was also at the same time looking for something that I thought would be fulfilling. And therapy was something that was always in the back of my mind. And when I decided that that was something that I wanted to do and pursue, I told her about it, and she affirmed me almost instantly and was like, please go back to school. We need you. We need more black therapists. And I was like, okay, fuck, I have to do this now because this is someone that's holding me accountable. But then I still dragged my feet, and then the pandemic hit and I got laid off from my job, and I was like, okay, I don't want to continue to put my future in the hands of someone else. I want to eventually work for myself. I want to be a therapist. Let me pursue it. So I picked a school, I applied, I got in, I started May of 2021, graduated in 2023, and every single step that I've taken has been a confirmation that this is part of my journey. This is what I'm supposed to be doing.
Awesome. You kind of took me on the whole ride there.
I did.
Right? And it's interesting that you said that you went into therapy and that's when you discovered you wanted to become a therapist.
Yes.
And as a therapist myself, I've had those moments with clients, especially the clients who are like, just starting college and trying to pick their majors. They end up going into whether it's social work or social services or psychology. They end up going into there because of their history, their past, their experiences, and the things that they conquered in that journey. They want to help others.
Absolutely.
Another thing that I heard you say was your therapist was like a role model for you.
Yeah.
right? You saw her a married woman and, you know, had a career. Like, it was a role model, right? That was almost your indirect mentor.
Yes.
Right? So that's a beautiful thing, and that's the connection that's important. She was a Black woman as well, right?
Yep.
So that connection was what we needed. And working with young men, myself, that's what they're looking for the most part. Some of them, it's not all kids without a father in their life, they need a Black male therapist. It's just that sometimes I need to unpack with somebody outside of my parents, someone in the home. Sometimes my issue is with my parent.
Right.
So I need a neutral place so I could truly understand where I need to go and why.
Right. You need someone that gets it.
Mm-hmm. So you are a therapist, and many people don't know that there's so many types of therapists out there, right? So share a little bit of what kind of therapist you are. What's the pathway that you are in?
Well, since I'm at the beginning, I feel like the world is my oyster in a sense. There's so many different modalities. There's so many different paths that I can take, and there's so much that I want to learn. Right now, I find that there are certain like evidence-based practices that are helpful, like CBT, cognitive behavioral therapy, dialectical behavioral therapy. But I'm also interested in creating a holistic experience for my clients. So there are certain modalities that I find myself drawn to that I'm like, okay, this would be great to incorporate, like movement, some sort of dance, some sort of somatic therapy that can tap into someone's unrepressed trauma.
Okay, you hit us with a lot of big words for those listeners who
did.
may not even know, right? But I want to pull us back a little bit. And, you know, with my question, I was wondering if you could share what kind of therapist you are, not the specialty, but there's, you know, I'm a licensed clinical social worker.
Okay.
Right? So which one are you?
Right now, I'm a licensed associate counselor.
Okay. So the abbreviation is
LAC.
LAC.
Yes.
Right? All right. And what does that journey look like for a licensed associate counselor?
That journey looks like working under the supervision of a fully licensed therapist, psychologist, social worker, and collecting a certain number of hours, and it depends on the state. New Jersey specifically, I think it's like 4,500 hours that you have to clock under supervision before the state says, okay, now you're ready to become a licensed professional counselor. You can practice on your own. You don't need supervision.
Yeah. And that's a lot of hours. I
It is.
think for a social worker, we're around 3,000 hours. And I want to say about 200 supervisory hours. So that's, you know, we have a lot less that we have to do for that. But at the same time, once you pass like 1,000 hours, you are really specializing in something, right? So you have those different modalities. We met at an event, right? And in that event, there were other modalities that haven't really been what most people learn in school,
Right.
At least not in the formal college schools and master's programs, right? So I want to get into that a little bit, right? Because obviously we both had some interest in that alternative therapy, alternative healing, right, so to speak. And then we could get into the evidence-based ones that we had to study for, right?
Yeah.
But in that one, we were at an event where they were discussing the use of breath work, as you mentioned, movement, marijuana, psychedelics and mushrooms, right? There was a few things that were there. What brought you to that place when we were there?
Well, I'm a personal user occasionally of marijuana and mushrooms, and I'm also really interested from the therapist's perspective of how to incorporate those healing tools in a way that can make a holistic experience for the person. Like you're saying, it's beyond what we learn in school. And I think that there is a place for it. I think we've seen evidence of that and how beneficial it can be when it's used with intention. So yeah.
So you say you a personal use of marijuana and mushrooms, right? Have you used any of those two in your journey of therapy?
So in sessions with my therapist, no. It's been more so like outside of therapy, I would say like on the path of personal development. So using them on my own, and like I was saying before, setting the intention and being mindful about who I'm around when it's happening, the dosage that I'm taking, all of those things are factors into the experience.
When you said dosage, I'm assuming that's more so for the mushrooms.
And also too for marijuana.
For the marijuana as well?
Absolutely, yeah.
The reason I'm like kind of jumping on the dosage for the mushrooms because I learned a lot that evening, and I saw that they were like, hey, just use a small dosage, this much instead of that much, because it has this kind of effect or that kind of effect. I'm scared to use the mushrooms, to be honest with you. From learning, I guess my ignorance would have allowed me to use it, but now that I'm more educated on it, I'm like, I got to be careful, if I might get like maybe something like a chemical imbalance from this, right? Do you worry about any of those things?
I think in the beginning, like before I had experience with it, I think it's natural to have that hesitation and that concern of like, okay, what am I getting myself into? I've heard things about it, but I haven't experienced it for myself. And so like you're saying, a chemical imbalance, that's a valid concern and something that was definitely on my mind. I think in the moment, it was just about me taking a leap of faith and trusting the person that I was with who introduced me to it and told me their experience and just seeing it for myself. At the end of the day, I feel like me personally, I have to see it for myself.
Yeah, because that was the thing.
Within reason.
They said you should be with somebody who knows how to use it before you use it. And I know when I smoked marijuana for the first time, man, me and my friends, we put a couple bucks together, we grabbed the bag, and we tried to figure it out on our own. There was no, hey, somebody sitting down and telling us any of the pros and cons. We were like, hey, look, we got, what was it? We had a backwood or something. We had maybe a dub sack. We crushed it up. It probably wasn't even crushed the way it needed to be. And a whole bunch of saliva. And it was like, yo, you wildin'. But, at the same time, we didn't have that guidance around it. So for somebody like me or who's never used mushrooms before knowingly, how would you walk them through that first experience?
I would say a good place to start is with microdosing, like similar to what you were saying before, how they brought up at the panel, there's like levels to the dosage.
Okay.
Microdosing, I think, is a great
Break
entryway.
that down, because I'm curious again. I got to refresh my memory, and others probably do too.
So to me, microdosing is taking like small amounts, like the smallest amount that you can take to feel. Now, I don't know exactly what that would be.
Okay.
I think it depends on the person, but the smallest amount that you can take within a period of time, and then just see how you feel. That's always my approach with anything. It's like if I'm going to try something, I'll try the smallest recommended dosage.
The use of the mushroom is usually like edible.
Yes.
Okay.
Yes.
There's no smoking of it.
I've never smoked mushrooms.
Okay.
I typically have ingested them. But I imagine now they probably might come in different oils.
Yeah.
I don't quote me on this, but me personally, I've only ingested them.
Yeah. So I mean, it's very interesting, and people are utilizing it for different things. They're utilizing it for like neurological experiments and research as well. Some people feel that it unlocks something in them cognitively as well. Did you feel like it took you somewhere to like a next, like you got not an epiphany, but you feel like, you know what, I've gotten something positive out of this, outside of whatever it is, maybe high, if you want to call it high or whatnot. Did you get anything from it?
Absolutely. I would say like the phrase unlocking something in your mind is the perfect way to describe what the experience has been like for me. There is something that happens where you are able to observe yourself in a non-judgmental way. It's like you step outside of yourself and you're looking down and you're just observing your thoughts, your beliefs, your feelings, and it just unlocks like different levels in your mind. For me, the biggest thing has been self-compassion. I tend to be someone that's in my head a lot, someone that can get paralyzed by self-doubt. And what happens when I take mushrooms, and even with marijuana, there's just like a calmness that comes over, and all of the things that I was worried about, I'm suddenly not worried about them anymore. Suddenly it's like, okay, why was I concerned about whatever it was? Why was I letting this paralyze me? It's not that deep.
Yeah. So it sounds like it was helping you with anxiety-related symptoms there, right? The
Yes.
excessive worry, the ruminating thoughts.
Yes.
It calmed you down, helped you manage it.
Yeah.
And self-compassion is a big thing, you know, and that's part, it falls into self-care
Yep.
as well, right? Do you see yourself reducing or stop using any of the two?
I don't know if I would ever stop. And to bring up the panel that we met, that was the first time that I had gone to an event where women, mothers specifically, were talking about using mushrooms during, before, during, and after their experience of being pregnant. That was something that I didn't really know much about and something that I had never considered doing. So to answer your question, I think in my mind, I always said, okay, if I ever get pregnant, I probably wouldn't partake in anything. But then after going to that panel, I was like, okay, wait a minute, maybe there is something to this. Maybe my hesitation has just been part of what feeds into the stigma of using drugs in general.
Yeah, it's interesting that you brought that up, because that was one of my, not concerns, but I was like, we have women here who are pregnant and they admitted, hey, I smoked and I used during my pregnancy. And at that time I was still working with children's services, child protection. And that was a big issue at some point, where the children or the infant will be a positive tox baby and they would automatically get an ACS report or child protective report. And the argument was, how is this parent truly harming the child? And one thing that one of those panelists shared was the relationship between you and your doctor is important.
Yeah.
And as I was thinking about it, most of those people that I saw who had cases because of the positive tox didn't truly have a relationship with their doctor. Half of them probably didn't even have insurance the way they needed to have it, right? So they probably didn't have a primary care physician. They just were going to this clinic and whoever was available is who they saw. So they didn't build a relationship with them. But educating your provider on what you're doing and how you're doing it could allow to buffer that from happening, right? So that was so interesting to me. And these women, they were like big CEOs of, in distributing different types of things related to marijuana itself. So that was awesome to see.
Yeah.
That was awesome to see. I remember, I could share a quick story. I remember having a case and the mother was a Rastafarian. And, we know what typically happens in a Rastafarian home, which is common. So, of course, the child was born positive tox for marijuana. And at that time, this was, I think it was 2010. It was over a decade ago. And, people weren't as knowledgeable or open about marijuana, cannabis, as they are now. So anything, it was like cocaine, cannabis, alcohol, opiates, everything went into one pile. They didn't separate anything. So as a CPS worker at the time, I had to truly work, not only investigate, but I had to educate the parent on the law, so she could know how she could respond to the law. because of course she's upset. Of course she's like, hey, look, I'm a Rastafari, my kids are okay, go deal with these people. This person has a kid who's on crack and da-da. It was just a whole ordeal. But I'm like, you know what? You have something that others may not have. You have a religion that supports that.
Yeah.
And you could utilize that in not just to make an excuse to your use, but this could be pivotal for my agency to be more aware of what's happening. So long story short, typically those cases get indicated, meaning that we found out that this was wrong behavior and you have a neglect or abuse decision on your name. In that one, we didn't. Simply because we educated them. I educated the parent, and the parent then educated the agency, and we compromised on it, right? But that doesn't happen a lot, especially in our communities.
Yeah.
So it was just important for me to be there to see that. It was just awesome. When we talk about alternative to therapy, and that's considered an alternative, have you been in a position where a client may have brought that up, seeking alternative ways to heal?
So at this point, not really. I haven't had any clients come to me and say, I'm looking for a specific thing. For the most part, the people that I'm working with just want to be heard. And so it's up to me to figure out what might work for them based on their interests. So for example, recently I had a consultation with someone who I'm planning to see next week, who's dealing with a host of issues. And I'm asking her, okay, so you're stressed out at work. What are some of the things that you do to cope? And she said, well, I love to paint. I love to listen to music, I love to journal, I love to meditate. So when I hear that, I'm like, okay, she might be someone that's interested in alternative ways instead of just like, well, in addition to, I won't say instead of, because we are going to be doing traditional therapy in the sense we're going to be talking, but in the meantime, in between sessions or even during them, it might be helpful if I figure out some art therapy interventions for her. That might be something that she responds to more so than just us having a conversation.
Yeah. You get to, when you have therapy with people and they opening up, some things that they do, they don't realize is an intervention.
Yes.
And you have to kind of highlight it in a way for them. Art, breathing, meditation, all of those are key elements.
Yeah.
I'm working in a school now, and before we start the day, we do something called sky breathing. And it's actually a breathing exercise that they do on the loudspeaker. Everybody has to dim the lights, focus, some kids follow it. I'm in a middle school and some kids don't. But for me, I know how important it is, and when I partake in it in the morning, I feel so relieved because my morning could be so busy.
Yeah.
I joke with my coworkers and I tell them, like, there's a school bus that comes here, but I'm a school bus driver before I get here because I'm dropping the kids off to different schools, getting ready, taking myself to a school.
Yeah.
So the mornings could be so hectic. So taking that moment to zen out before you start your day is so important.
Absolutely.
So important.
It's mindfulness at the end of the day. It's giving a person the opportunity to slow down and to be present and grounded in their body. And that's something that we don't really get the opportunity to do on any given day.
Have you had any clients that brought up marijuana use or any other substances?
I've had clients that have let me know. It's so funny because when I'm working with like college age students, they'll let me know without letting me know that they're engaging in drinking or substances, and I'm always reminding them that I'm not here to judge them.
What does it sound like when they bring it up?
It sounds like them saying, oh, I went to a frat party this weekend and we were indulging. And like, I'll just smile. And I know what they're talking about, but it's just funny how they they try to censor in so many ways like what they're doing, and then I always have to remind them I'm not here to judge them. Or I'll be working with like older people my age in their 30s, and they'll casually bring it up like, oh yeah, me and my partner, we went out this weekend and we were doing mushrooms and we had this huge revelation about our relationship, and then that'll open up conversation to explore what that means. And I always smile because I don't know why that I just enjoy that. I enjoy that people are finding healing. I think that's what it is, in alternative ways.
And you probably had a similar experience at
Absolutely.
some point, right? So you're like, it's taking you places.
Yeah.
I see what y'all doing, right? So that's important. And I think that's making yourself relatable with the client is important. So with like, I'm just thinking about certain sessions I've had. I had a client one time. I could tell they were a little bit, they probably just smoked, because their eyes were like slumped and they were like, yeah, kind of like dragging, mellowing out. And he wasn't going to tell me that he smoked before the session. And then I was like, you look lit. He's like, what you said? And just certain language kind of, and what it does, it helps build the rapport between you and the client. So they don't feel like, all right, this is a punitive place. But, I'm dealing with a lot of male clients, whether it's a teenager or adult. The adult, their girlfriend, wife, or mother sent them to me, and the kids, their teachers, their principals, their parents, sent them to me. So they feel like this was a punitive referral. I didn't really seek it on my own.
Yep.
For us men, a lot of times we have to hit crisis before we seek therapy. But once we get that rapport and we build on it, they open up about it. I tend to educate them on, all right, there's use and then there's abuse. And are we using this as self-medication, and are we building some kind of dependency on it as well? So once we begin to get into those conversations, they tend to open up, because I'm going to ask, hey, how often are you doing whichever thing you're doing, whether it's, weed, alcohol, whatever you're doing. I ask them about those things. So I kind of give them a little checklist on what's happening, not more so for me, but it's for them to understand too. Sometimes we don't realize, like, I'm using this a little bit more than I need to.
Yes.
Or maybe I got a little room to use it more than I have right now, right? So this helps them keep an inventory on what they're doing. Have you ever had a client who used while you were in session?
While I was in session, no.
Okay.
But similar to what you were saying, I've had instances where a client where we're meeting and I can tell they're drunk. Or they'll tell me, like, today has been a really rough day, I've been drinking wine. And I'm like, okay, all right. So I already know, like, kind of where the session is going to go, but also to approaching them with a non-judgmental energy, because I feel like that's important.
And I think the dynamic has changed. Like, someone who's probably drunk, they're probably not, you can't even drive a vehicle right now, sir. I don't think we could talk about your past trauma right now. But, because things have changed the dynamic of therapy, it used to be, well, it still is in office, face-to-face, but now mostly is virtual for a lot of people. So I know that you probably can't be in my office and you're smoking in the session, but if you're virtual and you're in your own home and you don't have any guidelines or rules around that you're breaking, you could partake in it, right? As long as the impairment is not happening in our session, right? So you could, you're getting lifted, so to speak, but are you unable to truly put your words together or things of that nature? I haven't had a client to do that in session yet, but I'm like ready for it. I'm like, I think you would. I think I would. We have to acknowledge it.
Of course.
I'm not just gonna just like see the smoke blowing and we're not going to talk about it. We got to acknowledge it.
Yeah.
And I'll make it a point that they have to be coherent during the session. And, you know, coherent meaning that if I'm speaking to you, you're not like spacing out, you know, you're not fainting. Who knows? Because a lot of people have different reactions for different substances you don't know. And I'll also unpack with them what made you smoke in this session, because I'm sure this is something that you know is not traditional.
Right.
What's making you do that? So kind of getting underneath it would be essential. I think part of the cultural competence in me is I've been in a music studio where it's nothing but, you know, weed in the air, and I've seen somebody put their music together like no other. Like it's just picture perfect. So I can't say, all right, just because you're smoking, you're impaired. You can't speak to me. You can't work with me. You're somewhere else, because I see people perform under the influence like that. So that's where my cultural competence will be, and that's where I would build a rapport with them and connect it with them. I'll also check to see how they did in the session compared to other sessions where they were allegedly sober. Who knows? They probably smoked before the session, right?
Right.
And, you know, and speak to that, whether they opened up more, whether they were more, you know, closed up during certain things, if their responses were short during this time frame compared to others. I'm going to make that clear so they have some insight on what's happening with them as well. Other substances, I'm not too sure, you know, how I would deal with it. I'm just familiar with marijuana, so I guess I'll be more comfortable with it. But I know with alcohol, if you're truly impaired with that, it's going to be hard for us to work together, you know. But I'm waiting for that moment to have the client who does that. I haven't gotten that client yet. But like I said, because things are virtual, I feel like it may happen sooner than later.
Yeah. And it sounds like you are prepared to handle it when it does happen.
As a fellow therapist, what do you think about how I would react to it? Do you have anything you would add to that?
Add to it.
Or change?
I wouldn't change anything. I like the idea of comparing the energy and how the session is going when they're high versus when they're sober. And bringing that awareness to them. And opening up and making it a conversation and trying to get to the root of like, okay, so what about this time did you decide that you wanted to get high?
With your, as you're working with clients, what's your thoughts around like self-disclosure?
So with self-disclosure, I'm very, I don't want to keep using the word intentional, but intentional is the word. I find, especially like in the beginning sessions, there are some clients who genuinely want to know more about you. And if you ask me a specific question and if I feel like it will help you to understand me more but isn't crossing any of my boundaries, I'll answer. And then for clients that I've worked with for a longer period of time and we've built that rapport, I might feel a little bit more comfortable to self-disclose, but most of the time staying on the surface. I very rarely, I would say, if ever, go deep unless I think it's going to be helpful. And I'm trying to think right now if I've had an instance where I've needed to. And I'm thinking of a client in particular who shared something with me that I've gone through. And at the time, I was really debating in the moment whether it would be helpful to be like, I've been there, I know what you're talking about. Ultimately, I decided not to, but that was something that stayed with me after the session. I was like, I wonder if it would have been helpful for her to know that I've also gone through this. So that's my long-winded way of, I'm still trying to figure it out.
It's tricky.
Yeah.
And I know that for the most part, when we're in that early phase of being a therapist, they say don't self-disclose anything,
Right.
you know, stay away from it. This could harm them. But from what I see, the clients are so curious about us. And it's not just, all right, I'm curious because I'm just nosy. They want to find some connection
Yes.
with us. And I feel like, especially like for us, a black therapist working with a black client, it's essential for us to self-disclose.
Yeah.
You know, so, you know, the easiest one to talk about is like, hey, you know, the client may share, oh, I got pulled over, I was so nervous, is this and that. I wasn't even riding dirty, but I just felt like this anxiety. I might share that. I had the same experience,
Yes.
and I'm going to have to share that with you and share how I dealt with it in that moment. Not just I learned this in a book and this is an intervention that helps with anxiety. I'm going to say this is how I operated in that moment. And they begin to connect and see that humanistic part of us,
Yep.
not just, all right, this professional in front of me who collects this payment, right? So they get to personalize us in that manner. So I find a way to flip it, all my self-disclosures, to, you know, for it to benefit them. And it works pretty well, you know, I feel. So, and I think, like I said, it's essential for especially black therapists, for us to share that with our black clients, because, you know, we're looking for some kind of connection.
Yes.
Because we also have to think about the stigma of therapy.
Yep.
Right? So the stigma of therapy, I should even be here. Only crazy people are here. And, you know, now them finding out my therapist has a therapist is astonishing for them. You have a therapist, but you already got all the training. Yeah, doctors go to doctors.
Absolutely.
You know, so
Yes.
therapists go to therapists.
Yes.
You know, we had electricians around here earlier. Electricians may do their own electrical work at home, but not all of us have that are privy to just being able to work with ourselves only. And sometimes we need that fresh set of eyes on what we're going through.
Absolutely. And I think it's essential for therapists to see therapists.
Mm-hmm.
I think you need to have that experience of being on both sides.
Mm-hmm. Mm-hmm.
I think that brings a level of compassion, at least for me. I'll say, like, when I'm working with clients, I find that I'm able to relate to them in a way that I probably wouldn't if I never had that experience.
Mm-hmm. So I had mentioned stigma a moment ago, and I was wondering, how was your experience dealing with clients and just the community itself when it comes to the stigmas?
Stigmas related to mental health,
Mental
like
health.
seeing a therapist in general?
To mental health, and also the stigmas around the alternative to healing.
I mean, I would say that it's improving, but I definitely get the sense, particularly with my therapists or my clients of color, particularly my black clients, there will be times where we'll be talking about family and they'll throw in, like, because you know that, you know, no one in my family. A lot of the times the clients that I'm meeting with, they're the first ones in their family to go to therapy.
Mm-hmm.
And that is extremely, it's difficult for them to be in therapy and be working on themselves and evolving, but then also having to go back and exist within their family dynamic. That's very dysfunctional. And when they're the only ones that is taking mental health seriously, I find that they really struggle with that. They struggle with being the first. And that's something that we talk about a lot in our sessions. So I would say with our generation and younger, I feel like the stigma around mental health, seeking help, seeking alternative methods to healing, I feel like it's lessening. But when we talk about older generations, that's where, in my experience, I find where a lot of the stigma is still prevalent.
Yeah, yeah. As you were talking, you were saying that it might be the first person in that family to receive therapy.
Yep.
I find some people keep therapy a secret from their family because of that. So they're the first, but the family doesn't even know there's a first person in therapy.
Wow.
But for all they know, they weren't the first person in therapy. There's a couple other people behind the scenes receiving therapy without letting you know, just like you're not. Sometimes I find myself pushing them to advocate in their family for it. Like, why are you not sharing that you are in therapy with your parent? What do you think is the worst thing that could happen if they know?
Yes.
And once they begin to rationalize, they say, you know what, I really should. They probably don't, they usually don't jump into, I'm going to just go there and make an announcement. But they're not scurrying into the car for their session or locking everything in their room in order to have some quiet peace to join the session. They're a little bit more open. They may step out of the living room and say, hey, look, I'm going to a therapy session. Like, where? Virtually, in my room. Yeah. And then that's that. So I think that's another part of kind of breaking the stigma that we have to do, like empowering the clients to be a little bit more open about having therapy.
Yes.
Because if you're going to the dentist, you tell me you're going to the dentist,
Absolutely.
You're going to your doctor. So why not be able to say the same when you're going to see a therapist?
I could not agree more.
Yeah, especially if your therapist is cool like us, right?
Exactly, yes.
Come on, like, look at my therapist. So I definitely encourage that. Now, another part of the stigma is, how is it for you in your family? Is your family, do they acknowledge therapy like that? Like, what's that relationship like?
They acknowledge therapy. My mom specifically, I'll speak to her. She's been to therapy before, but she's also very religious. And so her thing is just talk to God about it. She understands the concept of therapy. She understands that it provides value, but there is something, she always says to me, she was like, I don't understand how you can be in therapy for years on end. It seems like there's no end date. Like, when do you graduate? When are you done? And then I always have to say to her, you don't have to be in crisis to go to therapy. You can go to therapy when you just need, maintenance, when you just need someone to talk to about life's everyday stressors, struggles. It doesn't have to be the end of the world. So yes, it's like they're aware of it. And they understand that I'm a therapist, but I don't know if they fully appreciate. I don't know if they fully appreciate it.
They don't try to get free therapy from you?
No. Well, I don't know if my mom would see it like that. I think she recognizes that I'm a really good listener, but I don't know if she sees it that way. So thankfully, no. Have you had that experience with family members?
Oh yeah, I have.
To get free therapy?
I think I have more of those clients in the family than my regular clients. But they checking in with me like, hey, look, I'm going through something. I got to get this off my chest. But I get a lot of those calls, and I'm always welcome to it. You know, I joke with them and say I'm gonna send them an invoice, but I never do. Maybe I should start to set some boundaries. I don't know. But I do, and that's part of me trying to help them break the stigma.
Yes.
The funny thing is, sometimes they call me about an issue to unpack, and we may have another conversation about something else. They may be talking about somebody or something, and they be like, that person, I don't even know why they're in therapy. It doesn't work or whatnot. And I'm like, I just gave you a session last week. You didn't even realize it.
Right.
Like, no, you didn't. And then I have to break it down to them. Like, okay, this was a session. This was a active listening I did. This was an intervention. You just did a CBT when I asked you to do that after we finished speaking. Yeah. So, and they're like, that's what therapy is? And they become more and more open to it. Now I'm seeing more people seeking couples therapy, and the benefits of it. Because, I can say, hey, look, you could argue with your girl or you could argue with your man, but you probably need a facilitator in there.
Yes.
Somebody to referee the conversation. Like, yeah, I really do. I'm like, that's why we have a couples therapist. It's like, okay, can you give me some referrals? There you go.
Yep.
You know, I always send them to my man Mac, but he doesn't take any new clients. So we made a connection here. So my Jersey people, I'll let them know where they could go to seek some therapy, couples therapy. But, you know, that's something that I see, us kind of being more open in discussion. What we're doing now is helping breaking the stigma
Absolutely.
of therapy as well. So, you know, that's truly important. I want to pivot to more so to our profession, right? Mm-hmm. Therapy is our profession, but like just talking more so about now us sharing knowledge, experience, questions to better ourselves. What they say, iron sharpens iron,
yep.
right? So would you consider yourself a seasoned therapist? Like, what would you consider yourself?
I would consider myself a
Don't
baby.
be humble. Don't be humble.
I think I have a solid foundation, mm-hmm. and I think I had that before I even decided to go back to school. Mm. And I'm confident in that foundation. And like I was saying earlier, every step that I've taken along this journey has been some sort of confirmation that, okay, this is what I'm supposed to be doing. But with that said, I have a lot to learn. Mm. I think there's a lot that I want to incorporate, and I'm very curious, and that's the spirit that I have, that I want to stay with me. I never want to feel stagnant in this profession. And I think I want to be intentional about that, because there is so much that that's out there and that's being discovered as we speak, just in terms of interventions and mm-hmm. just new ways of thinking.
Yeah.
And I think especially as Black therapists, a lot of our work is unlearning. I'm not going to say unlearning the things we learned in school, but looking at it from a different perspective, like you were saying before, applying the cultural competence. Mm-hmm. And disclosure is a perfect example of that. That's something that's typically shied upon, but we understand that when we're working with Black people, our Black clients, they have to relate to us.
Exactly.
And so that's just an example of how we have to debunk the myths, the rules that we're taught.
Yeah.
I feel like I just went around in a circle.
No, you definitely said a lot, and something that I want to gravitate to is the part where you're like, you know, you're very open to learning so much, right? And I think that, you know, as a fellow therapist, I see a lot of people who kind of go into one direction immediately into their studies. And I think you need to kind of spread out and try almost all of them, you know. But there's this fear, like, I don't want to work with this couple and then they break up and I feel like I'm the cause of it. Or I don't want to work with this person who's suffering depression and they have a suicide attempt, you know. We have that fear of the outcome. But I think that we should tap into those different categories and seeing which one you gravitate to the most. You know, it's like my son KJ's 4 years old. My wife is like, I want him to play a sport. And she automatically wants me to put him in basketball because I play basketball. But I'm like, no, I'm going to put him in all the different sports, give him a moment and see which one he organically gravitates to.
Yes.
Right? And that's how, as therapists, that we have to kind of to do it too. Where do I gravitate to? And to be honest, you may start off wanting to work with individuals, and then you might spin off and say, you know what? I did a couple joint sessions with these individuals and I kind of like couples therapy.
Yep.
I want to go into that. Or I kind of like family therapy and I want to go into that. So all of that is important for you to do. And I guess when you want to wind down, you know, your clientele to just kind of specialize in it, that's when you choose. But try them all is the best. That's what I recommend to all you people in school, coming out of school. Try them all. Do your internships in different places, not the same one. It's my first time working in the school. It's completely different than any other experience that I've had so far. And I've worked in substance abuse, forensics, population, people in Rikers Island locked up,
Wow.
Individual therapy, couples, families. So, but it's something new, and I like it. I love it. But I would definitely say go into those different pockets of therapy and see which one you gravitate to the most.
I think that's great advice. And I can imagine that when you come out of school, there is, like you were saying, there is that desire, or I guess feeling of maybe I need to just focus on one thing right off the bat. But in my opinion, that's not how you get a well-rounded experience.
Exactly.
It's more so what you're saying, being open and willing to try different avenues, see what you like, see what you don't like, and not feel the pressure to make a decision and pick something right off the bat.
Awesome. Yeah, so we align with that, right? You have anything else you probably would share with somebody starting off?
This is going to sound so cliche, but they tell us this when we're in school. Self-care is extremely important. Finding the balance between your life and schoolwork, work, is imperative. That was something that I learned very early on, very quickly, starting in grad school after not being in school for over a decade, and being terrified that I wouldn't be able to acclimate myself. And one of my best friends told me, just take it a week at a time. And I took that advice and I ran with it. And
She's aggressive. She didn't even say a day at a time. Take it a week at a time, right?
A week at a time, yes. But it was hard. It was hard to balance working a full-time job, being in school full-time, trying to live a life. And you learn very quickly that you have to pour into yourself, because the work that we do is hard. It's not easy, and it requires a lot of energy. And I'm humbled and grateful to be able to do it, but I also recognize at the end of the day how depleted I am. And so that just gives me incentive. Okay, I need to pour back into myself, whatever that looks like. And to me, that looks like enjoying my life and spending time with people that I love, and dancing and doing all of the things that bring me joy.
Yeah, I second that. I truly agree with that. Self-care is, you see a lot of people. I mean, they used to have, if you pay attention to social media, they used to have the memes on this is what a therapist used to look like, right? And they're like, hair not done, looking kind of disheveled. And, they weren't pouring back into themselves. They were just pouring everything out till they're empty. And as we talked about in the beginning of our conversation, that mentor piece is important. If I'm showing you I'm just going to work myself to death, what kind of reflection is that for what you should expect to do for yourself? I have to be able to show you all right, I'm working, I have my boundaries, I have my self-care. I think that even during the times where somebody may walk past your office and you may be indulging self-care, whether it's just eating your food, they're like, oh, what are you eating? You're eating something that's good. I got to nourish myself. I got to take care of myself. You might be out taking a walk. A lot of times I see people, they're taking their walk. Some people, they got the watch and they're doing. All of that is part of that self-care that we have to indulge in.
Absolutely.
All right. Awesome. We had a very healthy and nutritional conversation here.
We did.
Yeah. I hope that, the listeners were taking notes. If not, watch it again, get your notepad, take some more notes, because we tapped into the conventional therapy, the alternative healing, self-disclosure, tips for therapists to come, and different avenues of the self-care that we need to tap into as well. So, this has been another great episode on BlackMenCryToo. I hope that you guys enjoy this, share this with anybody you think needs to listen to this as well. And do you want to say any closing remarks before you go for yourself?
I just want to thank you for this conversation. It has been an absolute pleasure. It has. I've really enjoyed it.
Do you have any way that people who they're interested to have their own conversation with you and probably services for you, how can they reach you?
You can find me on Instagram at The Curly Cognitive. I'm also on Psychology Today under Angela Bracey. Yeah, I think that's it. Oh, I'm also on Therapy for Black Girls under Angela Bracey.
All right, there we go. You know how to find her. Get your therapy on, fellas and ladies. Right? So thank you once again. Take care.